Hello everybody, I'm Dr. Sozer and I would like to present to you a technique I developed almost 15-16 years ago. It's a buttock lift and autologous augmentation procedure. Who are candidates for this procedure? For example, this type of patient, this is a weight loss patient, has extreme droopiness to the buttock. So this lady will require a buttock lift and the incision will be on top of the buttocks. This is the most concealable incision to do a buttock lift because a bikini will easily cover the scar. But what happens when you elevate the buttock? The buttock is a circular structure when you look like that and you pull on it, it becomes flat. So you have to do augmentation at the same time. How do we do that augmentation? Basically, this is the tissue we remove when we do a buttock lift. But instead of throwing this tissue away, we mobilize it with the vascular supply and take this tissue and rotate it this way and put it under the buttock. Then we pull the skin. When we pull the skin, we will eliminate these wrinkles and at the same time give fullness in the center of the buttocks, and if we want, we can even use this tissue to augment the hips at the same time. Here is another patient that requires similar procedure. Here is this patient who had a previous tummy tuck. You can see the scar doesn't have any fat, so you cannot do fat injections. So we do a buttock lift and augmentation at the same time. This procedure is excellent for cellulite. It will eliminate the cellulite 100%. Here you can see the medical illustrations. We detach the tissue with the vascular supply. The muscle, you can see that the muscle is attached to this tissue. We rotate it and put it in place. Here is the rotation. This is the buttock. This tissue turns from here, gets rotated and gives fullness in the center of the buttock. This line indicates the bottom of the buttock. If we look at this patient, so the plan will be do this excision and take this tissue, rotate it, put it here, and take this tissue and rotate it and put it in the hips. So here we can see the result achieved. Yes, there is a scar, but you can see the buttock fullness and also contouring around the hips. And here is another view of the patient. You can see this contour before, and we have much attractive contour afterwards. So basically, this is in a nutshell how we do a Sozer buttock lift and augmentation.